Hi guys, welcome back to my channel. For those of you new to my channel, my name is Abigail and I'm a mum, a wife and nurse manager. So today I'm going to talk about things that student nurses should never do. Some of it I have from experience from being a student, some of it I have from experience from being a staff nurse, and some of it I have from experience from being a nurse manager and having to intervene. So kindly share this video and don't forget to like, comment and subscribe for more of this kind of content. Stay tuned. So welcome back. There's no beating around the bush. Let's get straight into it. So the first one is, please don't get into any arguments or get confrontational with your preceptor or your mentor, and not in the middle of the ward or in front of patients. Seriously, it's not good and it's unprofessional. And if other people witness it, or if other staff witness it, which is highly likely, it could have a negative impact on how people interact with you or how other staff interact with you. Seriously, it's not good and it's not worth it. And with regards to the encounter, you're probably going to bear the brunt of it, whether it's psychologically or emotionally. And also, depending on the severity of the matter, it could actually be escalated and documented in your progress notes for your placement booklet about maybe your poor communication skills or your poor interpersonal skills, and you don't want that. So try to steer away from having any arguments or confrontations with your preceptor or your mentor. Also, on the topic of having confrontations or having arguments, I'm going to steer away a little bit from the clinical area for just 1 second. Don't get into any arguments or confrontations with your lecturer in the middle of class. Seriously, it's not worth it either, and you're meant to be maintaining a professional relationship with these people, and also you're not going to change what they've set out to teach. I know sometimes it can get a bit boring in the middle of class and people can get a bit tired and weary and sleepy. And when something like this happens, it can kind of get a bit exciting, but seriously, it's not worth it. And if you really, I'm not talking about like trying to clarify certain things, or maybe you're not sure about something and you're trying to clarify in the middle of class. I'm talking about a full-blown argument or getting confrontational with the lecturer. It's not worth it. If you want to discuss something like that with the lecturer, maybe take it up with the lecturer in the middle of class. Some lecturers allow for breaks in the middle of class, particularly long classes, or take it up with the lecturer at the end of class. And also, we kind of sort of want to go home. The next one is, don't be a smarty pants or a know-it-all. You may have a lot of theoretical knowledge or may have experience working as a healthcare assistant, like me, and as a result may have a good knowledge of certain workflows. However, don't let that interfere with your learning opportunities. Instead of being a know-it-all, I use my experience as a healthcare assistant and my knowledge from my pre-nursing course to my advantage, and I feel like that scored me a lot of brownie points with my preceptor. So say for example, we were in handover and it was handed over that a patient had a reaction to a blood transfusion. Straight after handover, I would highlight that patient to my preceptor and say that, okay, this patient needs to be prioritized. So I'm going to check on this patient and check this patient's vital signs to make sure that this patient is okay. And I'm going to check on the other patients and make sure that they're okay for their breakfast. And then after breakfast, I'm going to highlight that, okay, I'm going to help them with their hygiene needs and stuff like that. As opposed to being a know-it-all and saying, actually, I've worked as a healthcare assistant for 5 or 6 years and I've been doing a lot of vital signs, so I'm quite confident with that. So I'm just going to stand here and watch you do the medication rounds because I need experience with the medication rounds. So there are a lot of people that talk like this and they don't realize how they're coming across. So it's not that you can't mention that you need to do your medication rounds or you need experience with your medication rounds. It's just your delivery. You need to work on those kind of things and try not to come across as a know-it-all or a smarty pants, you know. And if in this scenario, you could say to your preceptor, actually, I need to get some experience with my medication rounds. I know it's quite busy, but I'm just letting you know. And leave it up to your preceptor or your mentor to make this decision. It could be a really busy ward or a particularly busy morning, or they could make up their mind and say, actually, come along, I'll let you do the rounds for 1 or 2 of the patients, and then I'll let you do the medication rounds for the afternoon and evening rounds. But try not to come across as a know-it-all or a smarty pants. Seriously, it's not a good look. The next one is, don't refuse an offer for a learning opportunity. Whether it's inserting a urinary catheter or changing a wound dressing or going to see an x-ray being done, don't refuse an offer for a learning opportunity. Even if you've inserted a few urinary catheters in the past couple of days or past couple of weeks, you can always say it in a subtle way that actually I've been inserting a lot of catheters lately and it is improving my confidence. So yeah, I'd like to put another one in to improve my skills. And with the x-ray, I know it sounds like it's just an x-ray, but there's a lot more to the ins and outs of having an x-ray done and the x-ray itself, like the bit of radiation that you're exposed to when you get an x-ray done. A lot of people don't know that. Or I remember when I think about 2 years into being qualified, I had to get a chest x-ray done myself, and I went down to the department to get the x-ray done. And when I got there, in the department, the guy asked me to take off my bra, and I very kindly declined and said no, I'd rather keep it on. And it was like, no, you have to take off your bra because anything that has wiring in it can't be kept on while you get an x-ray done. I didn't realize this, and I work in an oncology and hematology setting, and I'm sending people down for x-rays left, right and center. Every day on my shift I'm sending someone down for x-ray, and I'm telling you guys, I was 2 years into being qualified and I didn't know anything about wiring and x-rays. So you never know what you could pick up. It's not just a boring old x-ray, so don't pass up on a learning opportunity. The next one is, don't assume certain tasks or skills are beneath you. Say, for example, you've taken a commode from a patient's bedside and brought it into the sluice room and leave it there for the healthcare assistant to sort out. No, you've taken it from the patient's bedside, you sort it out. There is nothing beneath you. No skill is beneath you. Even in my current role as a manager, I've taken commodes from patients' bedside, assisted with hygiene needs, and provided support where support is needed. And I don't think anything is beneath me. So don't assume certain tasks or skills are beneath you. The next one is, don't take longer than the time allowed for your breaks. Seriously, it's not good, and it just sends the wrong message in terms of punctuality and your general interest in placement. And it can actually be escalated and documented in your progress notes for your placement booklets. So just don't do it. The next one is, if you make a mistake, don't lie about it, especially when you've been observed making the mistake. Like, I know nobody wants to get blamed for anything, and we all know those special colleagues that want to act like you've killed someone when you've really only broken a medication vial. Perhaps you were in a hurry. At least you know now to slow down when preparing your medications. Maybe that wasn't the perfect example, but you know what I mean. When you make a mistake, own up, reflect, and improve on it. The next one is, don't lie about having to attend reflective hours or self-directed study, I think is what they call it in the UK, just to get off your clinical placement. Seriously, it's not worth it, and someone could make a very big deal of it. There's so many people involved. You've got your preceptor or your mentor, the unit manager, the practice development nurse, the head of learning in the hospital, and your university. So seriously, any one of these people could make it a very big deal, and that could lead to a cascade of other problems. So don't lie about having to attend reflective hours or self-directed study. It's not worth it. You're going to get caught. So the last one is not really a do or a don't. It's more of an inspirational kind of a thing. So it's basically to be grateful for the position that you're in as a student nurse, as there are lots of people that are only dying to be in your position and haven't been offered a place. So definitely be grateful for the position that you're in. That's it. Thank you so much for tuning in. Kindly share this video and don't forget to like, comment and subscribe for more of this kind of content. See you next time.